This is a translation of the Arizona Hospital and Healthcare Association's, or AZHHA's, educational handout. Questions to ask your healthcare provider. This document explains how to begin the discussion of advanced care planning with your doctor. First page. Advanced care planning. As you prepare to complete your advanced care planning documents, you might have questions about healthcare in general or your healthcare options. Here are some questions to consider asking your healthcare provider. What is my current diagnosis, if any? Is my illness curable? If not, would you be able to estimate how much remaining time I have? How might my diagnosis affect my daily life in 2 weeks, in 3 months, in a year? What treatment options are available for me to consider? What advantages and disadvantages will these treatment options have? How might my illness affect loved ones who care for me? What should I do if the treatment seems worse than the disease and I do not wish to continue with that treatment? Are there any experimental programs for me? How is my illness likely to affect my state of mind? Will I become confused, forgetful, or incapable of making my own medical decisions? Is there something I am not asking that I should be aware of? Second page. Communicating your illness with loved ones. How can I explain my illness to my loved ones? What would you recommend saying to them? Is there anything they should know about my illness? Questions to ask about appropriate forms to fill out and hospice care. Do you think I should consider a Do Not Resuscitate or DNR order? What is a DNR order? What is cardiopulmonary resuscitation or CPR? What problems might I experience if I allow CPR to be performed on me? What are the benefits of allowing CPR to be performed on me? Would you please explain palliative care? What procedures or treatments does this include? Can I still have chemotherapy or other treatments if I'm accepting palliative care? What does hospice care involve? How will I know when the time has arrived for me to consider entering hospice? What procedures or treatments does this include? Do I need a DNR order to be eligible for hospice? Who should I talk to if I think it is time for hospice? What if I am in hospice for 6 months, but I am still not close to dying? Do I have to leave hospice care? Can I return to hospice care if I get worse again? I do not understand what you said about that. Would you please explain it to me?